Hey there, are you suffering from a pinched nerve problem in the neck, possibly into the shoulder area? I help people with this kind of problem all the time, and there's two main exercises that I start people out with whenever they see me in person for a pinched nerve problem in the neck and shoulder area. My name is Dr. David Midoff. I'm a specialist physical therapist from Paso Manual Physical Therapy. I've been helping out people with pinched nerve problems for years and years. We do it successfully. They get to avoid taking pain medications. They skip out on appointments where they're supposed to get injections with their doctors, and they cancel their potential surgeries that they were going to have in their neck because their problems get better and they can live life normally again. So I'm going to detail with you today the top two exercises that I start my clients out with when they've got a pinched nerve problem. And before I go into these, just a quick disclaimer. This pinched nerve issue can lead to a lot of other problems, and if it's real serious for you, I highly suggest you go get help immediately right now. I'll tell you more about this as we go through the exercises, but it's possible that this pinched nerve problem in the neck and shoulder can lead to other more serious conditions that people get surgery for a lot of times. Things like carpal tunnel syndrome in the hand and wrist area. You can pinch a nerve up in the neck and it can transfer the pain into the wrist and hand because of the way that the nerves pass into the shoulder and arm. It can also affect rotator cuffs. Some people have rotator cuff tears in their shoulder and they don't realize that it's related to a pinched nerve problem up in the neck area because there isn't really a whole lot of great diagnostic tools like MRIs and X-rays that can tell us what to do about these neck and shoulder problems where the nerve is pinched. So just be aware that if you've got other associated symptoms, your pinched nerve problem might be more widespread than you initially think, and it may be a good idea to go get some help or go get some diagnostic imaging if you think that it's that bad. Now, if you want to try out these exercises, proceed with caution. They're the best ones to start out with in most circumstances, but not all. So just want to give you that quick disclaimer. Now, the first exercise is a chin retraction. This is really simple at first glance when you see it, but when we have patients do it, they mess it up often. Let me simplify it for you even more though. They call it chin retraction, but what I want you to do is make a double chin. Everybody knows that. Just do this right here. That's the same as a chin retraction, making a double chin. Now, there's different ways to do this. Some people will hold it for 10, 20, 30 seconds, and what you'll feel is the muscles behind your throat working. That's good, you need that. You'll also feel some stretching on the back of your head and neck area. That's good too. Now, the intensity at which you go should be what you can tolerate. So if you're having a lot of pain when you do it, let's say you push back about 50% and it's starting to hurt your neck and shoulder area, then don't go more than that and just hold it there, get your muscles working there, it'll loosen up your joints. And I would do this for 3 to 4 minutes at a time. You can do this frequently throughout the day, even up to every hour while you're awake, of course. Just use caution, use common sense. If this is starting to hurt you over time, then do not continue to do this, and chances are your problem's a little bit more serious than you might think. So again, just to review that, you're doing a double chin or a chin retraction, hold it for 10, 20, 30 seconds, go as far as you can without setting off any sort of pain. Muscles working in here is okay, and stretching in the back of the head and neck is okay too. But if you start getting pain down into the shoulder, down in your arm or hand, definitely not a good thing to keep going with this exercise. You need to back off. The second exercise to relieve a pinched nerve in your neck and shoulder area is a shrug. Now, everybody thinks it's just straightforward like this, but what I actually want you to work on is raising your arms up as you shrug. So you might start out at just this level right here where you just hold your arms in front of you, and I like to have the palms facing each other like so, and you just shrug up while still keeping a little bit of a double chin, a minor one. You don't have to go real hard, maybe like 25% of what you can maximally do. And what you are trying to do is shrug your shoulders as high as you possibly can, as if you're trying to get your shoulders to touch your ears, and hold this for about 10 seconds. And to the point where you're shaking a little bit because you're putting that much effort into it, that's how high you should go. Now, as long as it doesn't bother anything in your neck and shoulders, besides muscles getting tired and fatigued, but if you don't have any numbness or tingling or pain that goes down into your arm, then you're clear to proceed. And what I'd like you to do so that you can get more relief from the pinched nerve problem is raise your arms up higher when you shrug the next time. So then go up to here and shrug from there, and eventually just straight all the way up and down like this. That's a harder version of that shrug. The thing I want to caution you about is if you do have some nerviness in your arm, some numbness or tingling going down into the arm, the higher you go up with your hands, generally the more tension you'll put through your nerves, and it may not be that comfortable. So find the sweet spot where you think you can shrug from while getting your arms up as high as you can without more problems in the arm. Now, work on this for several days, see if it gives you some relief. If it's just not working out for you, chances are your neck and shoulder pinched nerve problem is probably worse than you might think, and it's a good idea to go get some expert help. Now, giving you exercises beyond this requires some more expert attention, so I strongly suggest that you go get in touch with a specialist physical therapist or somebody who specializes in helping avoid medications, injections, and escaping surgery so that you can get this pinched nerve problem addressed. Doing these exercises inside the spine, the neck bones, it actually opens up the space and allows more space for the nerve to pass through. So it gives it some breathing room so that it can flare down and give you some relief throughout the day. If you don't take that pressure off and it stays pinched long term, you can suffer some nerve damage, you can get weaker muscles over time, and like I said at the beginning of the video, that might affect your rotator cuff, might affect you into the carpal tunnel. There's a slew of other conditions. Tennis elbow, pain out in the elbow can be contributed to from neck and shoulder problems, pinched nerves up in the neck and shoulder area. So I hope this video was helpful for you. Like I said, please be careful using these exercises. Don't do anything crazy. If they hurt, don't continue doing them. All you should feel is just like the muscles are working, like you're getting a little bit tired, and over the course of a few days, you should be getting relief from this pinched nerve problem that you're having in your neck and shoulder area. I hope this video was helpful for you. If you want to get more videos on neck and shoulder problems and how to fix it, hit the subscribe button around here and hit the little bell to get notifications about every time we release a new video. That way you can keep up to date with the best tips and advice for neck and shoulder problems. I hope you have the best day. Bye-bye.